our understanding of a given patient's cancer has been typically limited to two major factors: the anatomical location of the tumor, as well as how the tumor looks under a microscope using histologic stains such as hematoxylin and eosin. These factors then cause someone to have a given diagnosis, such as an adenocarcinoma of the colon or a squamous cell cancer of the lung, and then therapeutic options can emerge from there. More recently, technology has advanced such that one can look at the entire human genome from a pinprick of blood. One can take a small needle and biopsy a tumor and have enough tissue on which to really understand the genome of that given tumor. One could obtain a blood sample and look at circulating free tumor DNA and understand a bit about what is going on in that patient's tumor, the response that they may be having to a given therapy, and other factors that might be important for their management. And so the application has really been driven by several factors. One of them is the eligibility of patients for FDA-approved anti-cancer drugs because of the mutational drivers that one can find using a panel DNA test. This DNA analysis will look at a set number of genes, usually around 400 or so, and then be able to render data on whether that patient has a given driver that's directly associated with an FDA-approved drug. These can often be called companion diagnostics because of the presence of this genetic information in the prescribing recommendations within the FDA package insert. Another factor that's important for the use of these panel tests is to make objective decisions in situations where there is no standard of care. When one does not have an FDA package insert recommendation, an NCCN guideline, an ASCO guideline, an ESMO guideline on which to follow, one needs some direction for making an objective decision. You're often going to pick an expensive therapy for treating this patient. So why not pick one where there's more objective data on the probability of response compared to just picking one based on familiarity? Now, it is not yet the case that measuring DNA changes in the blood or in the tumor can replace CT scanning or other ways of measuring tumor response. It is also not yet the case whereby looking for minimal residual disease, looking for the presence of a precancer in blood, can be routinely performed based on DNA analysis. But both of those areas are ripe with exciting research, and it may be in the future these DNA panels, especially from blood, may be part of early diagnosis of cancers, screening programs, and may be part of trying to choose therapies early on and not just in the context of metastatic disease. Overall, obtaining a panel test for looking at the mutational burden and the mutational changes within a patient's individual cancer can be performed very readily. There is only a limited amount of expertise that is available for interpreting these reports. So often, that is a roadblock for translating exciting science into therapeutic options for a given patient. Now, if you are near an academic center, try to find the precision medicine experts and have them help you, making sure you get the most out of your patient's reports. There's also national resources, such as Clariifi, a company focused on this exact area, that can be beneficial to making sure that the patient not only has their tumor sequenced, but all the therapeutic options are pulled out, your chance of having them paid for by the insurance company and actually accessing the medicines for the patient are optimized.